Good afternoon to attendees, both in person and online, and thank you so much for joining us today. I'm Catherine Bowen. I'm the Director of the Climate Catch Lab and the Deputy Director of Melbourne Climate Futures. And I'd like to begin today's event by acknowledging the traditional owners of the unceded land on which we all work, live and learn, the Wurundjeri Woi-wurrung and Bunurong peoples. I also acknowledge and am grateful to the traditional owners, elders and knowledge holders of all Indigenous nations and clans who have been instrumental in our reconciliation journey. I pay respect to elders past and present and acknowledge the importance of Indigenous knowledge in the Academy. As a community of researchers, teachers, professional staff and students, we are privileged to work and learn every day with our Indigenous colleagues and partners. It is my absolute pleasure to welcome to this event our colleagues from beyond the university, including representatives from national, state and local government departments, some of whom have generously been involved in this project since it began 2 years ago. In particular, I'd like to recognise and thank the 28 state and local government policymakers who have generously contributed to this project through interviews, focus groups and providing input during the development of the toolkit. Without your involvement, this project would not have been a success. I would also like to welcome the Director of the National Health, Sustainability and Climate Unit, Australian Government Department of Health and Aged Care, Dr. Madeline Skellen, as well as the Manager of Climate and Health of the Public Health Protection, Practice and Response Branch at the Victorian Department of Health, who is also a research partner on this project, Vanora Mulvena, alongside her colleague and research team member, Rohani Savage. Finally, I'd like to welcome and acknowledge Fran McDonald, Coordinator of Environment at the Western Alliance for Greenhouse Action, who is joining us online today. I would also like to welcome university colleagues and other guests joining us in person and online today, including the head of the Melbourne School of Population and Global Health, Professor Santrain Pasricha, and the head of the Melbourne Medical School, Professor Sarath Ranganathan. It takes a village to complete a research project, and this project would not have been possible without the incredible support of university colleagues, including Elise Moo, Hassini Gunasidi, Kelvin Say, Becca Louis, Sophie Cullens, Christine Jover, Beth Barber and Pip Gerard. We have to also thank enormously Dr. Belle Workman, who has really led this project with wonderful inspiration and motivation, because it really has been a groundbreaking piece of work. So many thanks, Belle. And lastly, I would also like to welcome and acknowledge our colleagues from VicHealth, particularly Susan Mowry, who was so engaged and supportive throughout the project. We were delighted to receive one of these awards from VicHealth that really shows the importance that VicHealth is now placing on climate and health, which is just wonderful. So VicHealth were the generous funders of this project through a research impact grant. And it's been an absolute pleasure to work with Susan and the wonderful VicHealth team to deliver this project. So today we're here to launch the toolkit, Co-Designing Healthier Climate Policies. And as this project draws to a close, we're really proud to share with you several of the climate and health outputs that have been co-designed with a dedicated cohort of state and local government representatives who are passionate about and understand the importance of health considerations being incorporated into climate policies, as well as climate considerations being incorporated into health policies. As climate change continues to devastate communities, both domestically and abroad, we know that protecting people's health must be at the core of our efforts to act. And this project is an example of our evidence-based action at Melbourne Climate Futures and at the Climate Collaborative Action for Transformative Change in Health and Healthcare Lab, otherwise known as the Climate Catch Lab. The project really has reaffirmed the immense value of catalysing critical conversations with our local and state and federal counterparts in government as we seek to advance evidence-based action on climate and health across all governance levels. So today we will share with you the first suite of resources in what we hope will be an extensive and comprehensive toolkit co-developed over time to better support integrated approaches to climate and health policy and practice in Victoria and beyond. We really see this toolkit as providing a fantastic starting point for the rest of the country and potentially globally. I would now like to pass to Dr. Madeleine Skellen to provide a few words, given her integral role at the national level on climate and health policy development. Maddie.
Wonderful. Thank you, Catherine, for that introduction, and thank you for the opportunity to speak at this launch, at the launch of this really brilliant piece of work. So my name is Madeleine Skellen. As Catherine mentioned, I lead climate and health policy for the Australian government, and that means that I led development and now implementation of Australia's first National Health and Climate Strategy. I'm not going to speak for very long today, but I just wanted to position this really groundbreaking piece of work in the context, as I see it, of wider Australian climate and health policy. So our National Health and Climate Strategy is organised around 4 objectives. We develop actions in 4 areas: health system resilience, health system decarbonisation, international collaboration, and health in all policies. And by health in all policies, what we mean is embedding consideration of health impacts and benefits across climate policy development at a whole of government level, both thinking about mitigation policy, but also adaptation policy. Now, if I can summarise our progress in implementing the National Health and Climate Strategy over the 18 months or so since it was released, I would say that we've made amazing progress on the first 3 objectives and not enough progress on that 4th health in all policies objective, which is really what this toolkit that's being launched today is aiming to address. And so that's why I think it's such an exciting development. Why is it important to consider health impacts in all climate policy? Above all, if you think about addressing the health impacts of climate change, the health system has a role to play, of course, but the amount of health impacts of climate change that is amenable to what you can do within the health system is actually only a small percentage of those impacts, because most of the impacts of climate change on population health will go via impacts on housing, be mediated by the housing quality, by impacts on food systems, impacts on energy systems, impacts on transport systems, and so forth. So to really think holistically and address effectively the impacts of climate change from a health lens, we need to be looking beyond what's in the remit of your traditional kind of Ministry of Health or health service. So that's why I think this toolkit, which I'm sure you're about to hear a lot more about, is such an exciting development. It's a set of tools designed to help policymakers, practitioners, think about how to incorporate health considerations into the development of all climate policy, as well as a kind of community and citizen and consumer facing component, which is also equally important. I've reviewed the toolkit. I think it's a wonderful, kind of set of materials. Huge credit not only to the University of Melbourne team for developing it, but also for the role that VicHealth and the Victorian Department of Health has played in developing it. I'm very envious, and I'd love to find a way in the coming months and years of finding a way of rolling out a similar set of materials across the whole of Australia, noting some of these materials are kind of targeted towards kind of what specific institutions in Victoria can do. And of course, it's important to acknowledge, Victoria is such a leader in this space. There's nothing like this happening anywhere else in the country. And this University of Melbourne team that developed these tools, there's no work happening like this anywhere else in the country. So I just wanted to put on record my appreciation and acknowledgement of that groundbreaking work, which I'm looking forward, as I'm sure all of you are, to hearing much more about, and say that I really look forward to thinking about how we can develop better tools of this kind for rollout across the country in the coming period. So thank you, and I look forward to listening to the rest of the session.
Thank you so much, Maddie. Thank you for those words of support. We are here to help you figure out how we might be able to support other contexts as well across the country. And we would also like to commend your leadership. Getting up this first national strategy on climate and health within that timeframe was really incredible. So congratulations on all the work you've done in that field. And there's much more to do, as you say. So it's now my pleasure to invite one of our fantastic collaborators from the Department of Health, Venora Malvena, to reflect on progress and efforts at the sub-national level. So here in Victoria. Thanks, Venora.
Just also like to start by acknowledging the traditional owners of the lands on which we're meeting today, pay my respects to elders past and present, and of course any Aboriginal and Torres Strait Islander colleagues that might be joining us as well. Like Madeline, I'm not going to speak for much time today. I would like to leave the spotlight to Belle, who's really going to run us through this fantastic toolkit. And I would like to extend my sincere thanks to the University of Melbourne team for inviting us to partner with them on this grant in conjunction with other state government policymakers and local government policymakers. I think the critical nature of this work just shows you the power of partnerships that combine research with policymakers so that we make sure that that research is impactful, it can actually drive action both at state and local level. So I know I don't need to go into this in much detail. I'd imagine everyone in the room is already well aware that we are already seeing significant health and wellbeing impacts in Victoria. That is clear. We've been publishing and communicating the impacts of climate change on the health of Victorians for many years now. This slide just shows you just a few of those publications and some of the work that we're doing. Essentially to work on those hazards that are climate sensitive, not only direct impacts like extreme heat, etc., but also those indirect impacts. And we know that these impacts are already disproportionately impacting certain populations in Victoria. You'll see on the bottom left of the screen some work that we've published over the last couple of years, looking at the period where Victoria ran its own heat health alert system. Since the BOM has now developed a national system, we've adopted that system. But since the major heat wave in Victoria in 2009, we operated a system that ran up until 2022, and we did some work looking back at what those health impacts had actually been during that period. And particularly what we're interested in looking at was whether there are any disproportionate impacts, which we know from the international literature, where we're seeing that here in Victoria. And it really did confirm that certain population groups were being disproportionately impacted, but on those extreme heat days, everyone was getting impacted. And no surprise, that's people that are on low incomes, older people, Aboriginal and Torres Strait Islander communities. Absolutely not acceptable, and we need to be doing better. You'll also see there, we've published on things that maybe don't get as much spotlight, impacts on drinking water supplies. Top right there, you'll see a paper that we published on salmonellosis notifications, so foodborne impacts. We're seeing the suite of those, and you'll see that we also include a key focus on climate change and its impacts on health as part of the biennial Chief Health Officer reports, which you'll see in the middle of the screen as well. And this is a quote I often quote. I think it's really critical that we know we are seeing these impacts worldwide. And really the evidence is unequivocal. We know that climate change is a threat not only to human health and well-being, but planetary health, which of course encapsulates human health as well. And that we really do have a narrowing window to secure a livable and sustainable future for all. And that includes that most critical focus on mitigation, but of course on adaptation, given we are already seeing those impacts as well. As a result, it's really clear that climate and health needs to be central in both our mitigation and adaptation efforts across all sectors and governance levels as well. So I'd just like to briefly touch on just some of a very small suite of work that we've been doing that really does attempt to work across different levels of government, but across different portfolios and sectors within government as well. I'm sure everyone's aware that tackling climate change and its impacts on health is one of the key priorities in the Victorian Public Health and Wellbeing Plan. There's also linked areas in the plan, and this was a really deliberate effort. You'll see other areas of the plan talk about things like healthy eating, active living, mental health and wellbeing, etc. And those really what we've attempted to do is trying to highlight the intersections and the benefits of work across all areas as it relates to climate change and vice versa. The priorities of the plan and the aims of having that focus area there are to increase action to reduce greenhouse gas emissions at the scale and pace required across system to reduce health impacts and realize associated health co-benefits. You'll see that language in there. Of course, to accelerate action to support communities to adapt. But also importantly to share successes and promote good practice examples. And that's deliberate language. There is fantastic work happening at state and local government level, community-led work as well, and work through peak bodies as well. So the other work that I've highlighted here relates to some work that's been done under the auspices of the Victorian Public Health Wellbeing Plan. And I should flag that that plan is a statewide plan. It's branded a Department of Health plan, but in fact, the governance of that plan jointly sits with us and the Department of Premier and Cabinet. And the governance group that actually is in charge of implementing the plan includes every portfolio within government, so that that's transport, environment, et cetera, agriculture. So that's a really key thing. Some of the work we've been doing, as I mentioned, in line with a couple of focus areas in the plan is around healthy and sustainable food systems. You'll see a link there, and we'll share these slides, I think, post, but to a few resources and that we've published. One of those is the Good Food Policy, and this one is one that actually requires all Victorian state government departments, where they are purchasing catering for meetings, functions, and events, to make sure that that catering is healthy, but also that where possible, people are actually engaging social enterprise, Aboriginal-owned businesses, and importantly, businesses that are implementing good environmental practices, reducing food waste, et cetera. That is the first of its kind in Australia. It is a specific obligation adopted by all secretaries of all departments in 2023 and being rolled out. We have made a model policy based on that and a guide available for anyone else who'd like to leverage their own buying power. There's a lot of money. It might seem small catering, but if you add that up across organizations, it's quite big. And we've also funded the Healthy Eating Advisory Service, which is part of Nutrition Australia, to develop what we call the Catering for Good directory. And that's a directory where anyone can go to actually find those caterers that are Aboriginal and social enterprise, that are actually implementing good environmental practices and those healthier options. And we know that healthy eating actually has major health benefits if we're not relying on processed and packaged foods, and a good focus on vegetarian and vegan options as well. At the local level, and this will be no surprise, I'm sure we've got some local government colleagues on the line now. Already, we know that local government is taking really progressive action, and I'd say Victoria is a leader in that space at the local government level. And we know that under Victoria's Public Health Wellbeing Act, councils are actually required to prepare municipal public health and wellbeing plans every 4 years. And they have to have regard to the state plan when they do that. And so tackling climate change and its impacts on health as a focus area was a deliberate aim, not only to get some traction at the state level, but also to provide another compelling reason for local governments to accelerate action as well. And importantly, under Victoria's Climate Action Act, councils are also required to have regard to climate change when preparing those plans. So if there wasn't already a strong impetus for them to do that, we've got that there. Late last year, we published some updated guidance to support the next round of council plans. And that has a focus both on mitigation and adaptation and includes deliberately work. We co-designed this research or this guidance originally in 2024 with councils, informed by actions that are being undertaken here in Australia, but elsewhere. And there's more than 50 example actions or strategies within that guidance. But really critically, I mentioned that sharing successes and good practice examples. The latest guidance includes 12 Victorian local government case studies, many of which have been actually evaluated, including from some of the room today, which is really important. We are trying to get more of a focus on actually the evidence behind them, the impact they've had, so that we can share that as well and actually accelerate action again. The next round of municipal plans are due later this year, and it's a really critical action to a critical opportunity really to accelerate the action that's already occurring into the next round of plans. And we really hope that we'll see much more ambitious action moving forward as well. And of course, in addition to the really ambitious action that is happening at state level around emissions reduction, I guess the other one, again, showing that cross-portfolio approach, is the system-based adaptation action plans that are required to be prepared every 5 years under the Climate Action Act in Victoria. The Health and Human Services System, which sits across our department and the Department of Families, Fairness and Housing, is one of those plans. Critically, what you'll see within our own plan, 14 strategic actions, which speak not only to public health actions, which kind of sits in the area I'm in, infrastructure resilience, that includes our hospitals and health services, but also because this sits with the Department of Families, Fairness and Housing, there's actions around social and public housing, and then of course, sector capability and workforce. The other plans that sit within the Act, you'll see listed on the bottom right there. A really critical thing that we did deliberately when we developed the first round of plans was to identify those cross-system risks and opportunities. We actually ran and led from health a series of workshops with different portfolio leads across transport, planning, built environment, natural environment. And you can imagine, as Madeline said, health is in all of those, to really call out the role that other systems have to play in the adaptation space that are critical for making sure we're protecting and improving health. And again, there's another opportunity with the next round of plans due next year that I hope we can build on and leverage that work, particularly that really critical cross-system work that's needed on health. So just to finish, we know that health and wellbeing impacts are escalating. That is evidently clear. Well, at the same time, the scale of opportunity to protect and improve public health and wellbeing is also unprecedented. So there is lots of hope. It's also really clear that equity and climate justice must guide our response, including ambitious, and it's also very clear that ambitious systemic transformation is critical. That's both on mitigation and adaptation. And finally, I love this quote from WHO. Human health needs to be part of an integrated mitigation and adaptation agenda across all sectors and governance scales. And I think I'll leave it there. Thanks, Catherine.
Thank you so much, Venora. Just an incredible spectrum of work that you and Ro are leading in the Department of Health with others, I know. But it's really wonderful to see your ambition, to see your recognition of this being a systems issue, and to see the importance of both adaptation and mitigation in all of the work that we do. And just again to reaffirm the importance of co-design and collaboration in this space and engaging with policymakers for all of us right at the beginning of our projects if we do want to see the maximum impact in terms of policy change and policy influence. So we have an incredible partnership with the Department of Health, and we're very, very fortunate that we do. And I just encourage you all to think about how you might engage with your colleagues in different departments to amplify the work that you do as researchers as well. So with that, I'll now pass over to Dr. Belle Workman, who really has been the engine room for this piece of work and has led it with great wisdom and I think really wonderful collaboration with all of the different stakeholders. So Belle will walk us through the project and the output. So welcome, Belle.
Thank you. Thank you very much for that very gracious and overly kind introduction, Catherine. Before I go any further, I would also like to acknowledge today that we're on the lands of the unceded, the lands of the unceded lands of the Wurundjeri Woi-wurrung people, and pay my respect to elders past, present and emerging. And I also would like to start with a thank you today. As Catherine mentioned, it does take a village. And this project certainly took a village to design, develop and complete. And every day we're lucky enough in our roles to solve different problems. And I feel like it would be remiss of me not to take this opportunity to extend my sincerest gratitude to the multitude of people who are involved in developing this piece of work. We've got colleagues in the room who were formative in shaping the outputs, colleagues online who supported in recruitment and the co-design of the outputs. And it just really sets this project up for success going forward as we look to build on it. So acknowledging that there's still much work to do, we're really just excited to be able to present to you the outputs that have been developed today that represent one piece of the puzzle that we're all working towards, which is to see health better integrated into climate and policy and planning processes. So, as Fräulein Maria reminds us, it's best to start at the very beginning. And so just for a little bit of context, this project actually began, or its predecessor began a decade ago, when we were interviewing at the national level policymakers across departments to understand their consideration of health outcomes as they were developing climate policy. It was a critical time for countries around the world. We had the Paris Agreement in December of that year. So in June, we were in Canberra speaking to our colleagues to understand how they were developing their intended nationally determined contribution that they would take for Australia to Paris as part of our obligations and pledges. What we learnt as a result of that research at the time was that health was really very much a peripheral qualitative consideration in the development of our nationally determined contribution. There were two people within the Department of Health responsible for the full spectrum of environmental health-related issues, as well as climate change. And so there was very limited capacity, internal capacity, and interest across departments to consider and account for health in the development of climate policy and planning. And so with some generous funding from the EU, we set about looking to understand how we could potentially support policymakers to reframe how we had considered health and climate action up until this point. Historically, climate action has always been viewed as a burden, a cost, full of socioeconomic implications. And we really saw health as a key to reframing that, to support an understanding that health actually could allow a reframing around thinking about action as an opportunity with multiple benefits, not only for health, but much more broadly as well. And so we developed the first initial decision support tool, which was an overview of the evidence-based literature on the health benefits that accrue from mitigation interventions across sectors. And this was the first decision support tool that we developed and really then set the scene for this subnational project. So fast forward to 2023, and we had the opportunity through a very generous VicHealth research impact grant to look at what was happening at the subnational level. We knew, given the history of the political toxicity of climate policy in Australia, that at the subnational level, there had been a lot of heavy lifting happening across a number of years. As Venora has already talked about, there was incredible diversity in Victoria in terms of different experiences of climatic risks. And unfortunately, we've had a number of our communities devastated by the impacts of climate change already. As Venora has highlighted, there was a number of incredible efforts that have been undertaken to date to really support both communities and policymakers and practitioners understand how to consider health in the development of policies and planning. Beyond, I suppose, mitigation adaptation targets and adaptation action plans, as Venora mentioned, we also have legislative requirements at the local council level, which require municipal public health and wellbeing plans to have regard for climate. There are also a number of different tools and resources available through the Greenhouse Alliance groups as well, including the How Well Are We Adapting Toolkit, which often came up in our interviews as a key resource, and the very soon to be formally launched Victorian Climate Resilient Council, which our wonderful colleague Fran McDonald has been very busy working on. So very briefly, just a quick project summary. Our overarching question for this particular project was, how does a cohort of Victorian state and local government policymakers consider health outcomes during the development of climate policies, and what additional tools and resources are needed to maximise health outcomes in policy development? So we were really eager to understand the status quo. What were the current practices, attitudes and knowledge around around health as it pertained to climate mitigation and adaptation policy development, and what existing evidence and tools were available to support policymakers in this process. So we had our existing mitigation decision support tool, and we're actually able to use that in our interviews as a bit of a prompt to start the conversations and understand exactly what it might be that policymakers potentially need. And as a result of the responses and the conversations that we had with that very generous cohort of participants, we set about a commitment to making sure that we co-designed additional tools and resources to better support healthier policy development. So over the course of several months, we undertook 24 interviews plus one focus group with 16 policymakers representing a multitude of Victorian state government departments and statutory agencies, and 12 policymakers representing both metropolitan and non-metropolitan councils, working across multiple areas, including health, environment, sustainability, social and community development. Following the interviews, we undertook thematic analysis, and really for the purposes of today's presentation, have grouped those around knowledge, attitudes and practices, barriers and enablers, and needs and communication. And we'll just present a few pertinent quotes today to support, I suppose, an understanding of those conversations that we had. Following those interviews, we understood as part of the co-design process that it was critically important to reconnect with our cohort to best understand how to begin developing those outputs prior to us jumping in to developing them, to really understand and validate that we had understood the responses and the information that had been provided to us, but to also seek input very early on the design and functionality of the outputs. Those workshops were predominantly in person, and so also facilitated cross-sectoral collaboration through a networking model. So very, very high level, we're in the process of finalising a manuscript that will present our interview results. But as a snapshot to pique your interest, we found that in terms of knowledge, there was diverse knowledge across the cohort who participated around the health outcomes or impacts as they pertained to their particular areas of work. There was the capacity to articulate both physical and mental health outcomes, as well as to articulate specific priority populations that we know are most at risk from climate-related health impacts. So we had discussion of First Nations people, the elderly, culturally and linguistically diverse communities as just some examples. You'll see from that second quote there that in terms of attitudes, and acknowledging that, again, diverse, but there was certainly some recognition within the participant cohort that health and wellbeing was actually quite a key driver for many of them in terms of the policies that they were developing. And they saw that as being incredibly important for the government and the local council to have that as a focus, that ultimately at the end of the day, the work that they were delivering, the outcomes they were delivering were about people and ensuring that people had access to the services and protection that they needed in a changing climate. And then we also heard from participants that there were very diverse practices that currently existed in terms of how they then went about developing their policies and undertaking their planning. So you can see that final quote there from a local government representative who talked us through the step-by-step process that was taken, including a community survey. And that had implications too in terms of the outputs we developed, which I'll touch on in a moment. In terms of barriers and enablers, unsurprisingly, a very common barrier was around resource constraints, both funding and competing pressures and priorities. There were also barriers raised in relation to indicators and access to local data, particularly at the local government level, and understanding, which we know is a challenge and really an area for further research about detection and attribution. So how do we ensure that we're using the correct indicators to actually measure change that's happening and that we can attribute to our interventions? Another issue that was particularly relevant at the local government level was around roles and responsibilities and where the community understands or perceives government's roles and responsibilities to be. So something that came up quite commonly was that at the local level, rates, roads and rubbish are seen as kind of this very narrow focus of our local councils, and that actually then creates some barriers or challenges for local council who then want to engage in, say, broader sustainability or climate and health related issues within their community. On the flip side of that, as Venora mentioned, and as I previously mentioned, there are legislative levers that exist within Victoria. And as an enabler, that was certainly recognised by a number of our participants, that created a really important lever in order for them to have a mandate to work in this space. And I think that final quote from a local government representative is particularly powerful, recognising that there was actually very limited support from senior decision makers. And so in the absence of a legislative requirement, they wouldn't have been surprised if it hadn't been a feature of the plan at all. So finally, around needs and communication, following on from those previous results, it's probably unsurprising to you that we realised that in the first instance, and what the focus of this first suite of resources should be, is around addressing literacy gaps, both within agencies, units and departments, as well as amongst the community. And so that's really where we focused our attention and our effort in this first suite of resources. It's about trying to articulate in a compelling and an accessible way what the potential health benefits might be, ways that community can protect their health in a changing climate, and why this is actually the remit of government across governance levels to be involved in this space. At the same time, or in parallel to this process, we also undertook a rapid scoping review of the literature on the health co-benefits of adaptation interventions. We'd already undertaken that previously for mitigation. There's quite an extensive amount of literature in this space on the mitigation health-related benefits of mitigation interventions, but we realised that there was an opportunity for us to explore, particularly given we were planning to develop a sister decision support tool for our for the adaptation sector, an opportunity to really revisit this literature. This is also in the process of being published, this research, but we identified 25 eligible studies that were relevant for this particular scoping review. Not really anything surprising, but useful to share here. Built environment and nature-based solutions were the key areas, systems or sectors where we often see health co-benefits articulated in terms of adaptation efforts. And in relation to health outcomes, more at the moment in relation to physical rather than mental health co-benefits. You'll also see there on that graph on the right-hand side that there's also there's reference to co-harms as well. Critically important when we're thinking about policy development, that we're not just focusing on what the potential benefits might be, but also thinking about how we avoid unintended health consequences as well. Some other interesting things that we found from this review were very few studies took the time to cost the interventions, adaptation interventions that they were discussing or describing, and very few quantified any of the health benefits as well. So we see this as a particularly important area for future research, which we can advocate for. But the results from this review did inform the development of the adaptation decision support tool, which I will show you in a moment. I'm going to speed up a little bit now because I want to make sure we do have time for questions. But just to say that prior to developing the outputs, as I've already mentioned, and as part of our commitment to a co-design process, we undertook 2 workshops with our cohort of participants. And it was critically important. I don't expect you to be able to read that table in full detail, but the most important part of this process was that we had the opportunity to validate and to share with our cohort what we thought we had heard, what we heard, and to validate that that was correct, and then to discuss with them our proposed solutions. And so these workshops actually allowed us to clarify what types of features should be incorporated, who the target audiences should be, before we then jumped into output development. And then once we started the output development process, that meant then that when in terms of input and feedback, we already knew that we were on the right track. So the toolkit, it's my absolute pleasure to be able to acknowledge and recognising the incredible hard work of colleagues who helped to see this be prepared and ready for today. An online version of the toolkit. We also have hard copy versions of 3 of the tools available for you to take with you today. Please feel free to use the QR code to access the toolkit that's currently available online. So at the moment, the toolkit comprises 5 resources, which I'll share with you momentarily, as well as the mitigation decision support tool that we had already developed. And critically important to recognise or know is that each tool has been developed to be accompanied with an editable or modifiable template. We recognise that from our interviews that there were very diverse perspectives and local needs and priorities. So alongside ensuring that we had developed a tool that was fit for purpose for the general population, we wanted to ensure that the tool had the capacity to be updated as new research became available or customised for specific settings. And having an adaptable or modifiable template on the website for each resource means that we actually do have the capacity to transfer or ensure that those outputs can be used in other settings. So we're really excited to be able to share this with other jurisdictions across Australia, but also, as Catherine said, beyond as well. A very brief show of some of the resources, and then we'll get to question time. So the tool on the left is our sister tool for the mitigation decision support tool. It provides an overview via 6 systems or sectors of the health co-benefits of specific adaptation measures. And the tool on the right is a high-level overview 2-pager of both adaptation and mitigation health co-benefits. So we thought it was critically important to have 2 more detailed separate brochures and then 1 high-level 2-pager to better support decision makers as they're thinking about it, particularly where integrated approaches are happening and mitigation and adaptation planning is happening concurrently. We've also developed a community fact sheet that has that attempts to address some of the literacy gaps we know exist in the community. Importantly, we have had this translated into 5 different languages: traditional and simplified Mandarin, Arabic, Vietnamese and Punjabi, and they will be available on the website. But see this as being a critically important resource and tool to connect in with our local communities and communicate, I suppose, the relevance of climate and health, but also critically importantly, what the steps are to protect not only individual health, but the health of those around us. And finally, 2 tools. The first on the bottom left is a graphic taken from the first slide in what is a very accessible, high-level introduction a set of training slides specifically developed for policymakers with knowledge on climate and health to share with their colleagues, particularly senior decision makers, so that they can understand why this is important to them and what the benefits are from actually engaging in this space. Finally, on the right there, top right, you will see the Climate and Health Economic Co-Benefits tool. And I'd like to take this opportunity to thank both Dr. Kelvin Say and Becca Liu, who are here today, for their incredible efforts in developing this tool. It's the first that we're aware of that operationalises the WHO's Climate and Health Economic Framework, which from the responses we had received, is an excellent starting point in terms of explaining the processes for starting to quantify and demonstrate returns on investment in healthy climate policies. But to date, there had been very limited tools to support the operationalisation of that framework. So we see this beta version as an excellent opportunity for us to understand what inputs are needed, what data we need across different levels, and what the anticipated outputs or outcomes might be from an economic standpoint. So a huge piece of work, and a huge thanks again to Kelvin and Becca for your efforts on that. Very quickly, and then we'll move to the Q&A, just in terms of next steps. So as I've already mentioned, we very much see this as the beginning rather than the end. We know that there is definitely more that we need to do in this space from the interview responses that we've received, and the conversations that we've had. So we remain committed to securing funding in order to access or to extend and expand the toolkit over time. But as a first step, the tools that have been developed as part of this project will be incorporated into the Victorian Climate Resilient Council's program. And we're very grateful to the Western Alliance Greenhouse group for supporting that process. Additional resources and tools that we know that need to be developed and we will seek funding to develop include addressing additional needs, particularly around current impacts and costs based on local data, the consideration of culturally appropriate interventions in specific priority population groups, supporting local decision making, such as incorporating what questions to incorporate into community surveys to help them measure progress and action. And also capturing community-led adaptation efforts and their consideration of health outcomes as well. There's also really important to ensure that we're disseminating and piloting this across settings, both urban, regional and rural settings and non-Australian contexts. And we look forward to piloting these set of resources in the Pacific as part of a project that we have had funded through Welcome, which is shortly to commence. So there will be an opportunity for us to test these in an international context coming up. And then just finally to say that we, beyond the literature review and interview manuscript, we also think it is critically important to document and have in the published literature the process, the co-design process that we used to develop these outputs. Because without that process, I have no qualms in saying that there's no way that these outputs could have been as fit for purpose or are likely to be as effective as they will be. So certainly feel that the co-design process was absolutely essential in order for this project to succeed. I will stop there and thank you very much for your attention, and we'll pass to my wonderful colleague Elise to commence the Q&A. Thank you.
Thanks, Belle, and I'm sure you'll all join me in congratulating and thanking Belle for really spearheading and leading this effort and the development of these collaborative resources. So we have just around 10 minutes now for some questions to any of our panellists or the research team. Before we have Sophie checking if there are any questions online. So if you're joining us online today, feel free to pop those into the chat, or you can raise your hand and we'll unmute you. But to kick us off, is there any questions from the room? If not, I might take the facilitator's privilege just to ask Belle or perhaps for Nora as well, whether you see any learnings from this project that might inform and the broader work that the Victorian Department of Health has been leading to support the development of health and adaptation plans. Any key learnings for other jurisdictions that we might be able to glean from this project? You should be able to speak from where you are because this room is very high tech.
Yeah. Well, I guess no surprise, I think probably to anyone, but for me, it was so beneficial to be able to work directly with researchers, really leading researchers in the space. Fair to say government, I'd say state and local, tend to be dealing with lots of different priorities at the same time, often time poor and juggling lots of things. So to be able to partner directly with research, I have to say the Catch Lab and Melbourne Climate Futures have always had that real strong dedication to working with policymakers and working collaboratively. So that's a learning for me, just how I guess, yeah, what you can do when you partner up and the advantages of that. And I think for other policymakers, it of course does take time and effort, but in the end, I think through that partnership, you can get really good outcomes as we've seen. So yeah, it's probably my thing that Bill.
I would just echo that and say the critical importance of partnership. I feel like we've already seen through participants invitations to be involved in multiple ways in the development of plans going forward. And so it's just reiterated for me the critical importance of partnerships and for those to be early on in the project process. So
thanks, Belle. Nora, any other questions?
Question. I was wondering, building on that first question, if you have any examples of policies where that integration of health into a plan policy has been done well. You showed the example of the Victorian Healthy Homes program as an example of how that can be done well. Are there any other examples that you came across either from within Victoria, from local councils or elsewhere where that's been done well that we can learn from as well?
I'm happy to kick off. So that was something we were really eager to identify, particularly for our 2-pager on health co-benefits, to really understand where it had been done well, but particularly where it had been quantified, and we could really see those cost benefits. The Healthy Homes program is one of, I think, the best examples that we have, and I know it's used internationally as an exemplar of how to quantify and capture those health co-benefits. From memory, we had another couple of examples on the back of the 2-pager. There's a table incorporating some additional costs or benefits that have been costed. But I don't think that they're a result of specific climate interventions. So I actually think that the Healthy Homes program remains one of the best, certainly for Victoria. I think a lot of other examples sit beyond Victoria and indeed beyond Australia.
I was going to say, yeah, I think that it's a real standout. I think it's even featured in the Lancet Pathfinder, perhaps, internationally, which is pretty exciting. I think that was probably something we did find, though, that as Belle mentioned, there's not a lot of case studies or examples you can find where people have actually quantified benefits, the health savings, which the Victorian Healthy Homes Initiative did. I should say that was a pretty high budget process. They had epidemiologists working on it. That's pretty rare these days. So I think it is something that we're certainly keen to gather more information on and data, but that requires money to be able to evaluate and capture those benefits. But I'd see opportunities coming out of this work. And certainly I think you mentioned that up front, Belle, that's something that we need to try and capture better as we're bringing projects. But a little plug for our local government guidance. There's lots of amazing case studies at the local government level that in Victoria people are doing. We also publish a quarterly climate change newsletter for local government. And so we make a point to try and feature those examples as well as we go. But lots more we need to do, but some certainly good examples to study.
And if I may, embedded within the toolkit and the resources that Val promoted, the example of with using the climate and health economics tool actually has an example of how you can cost benefits using the healthy homes as an example. So there's a video and there's a field-in template. So really encourage you to, and any others online, to have a look at that if they're interested in how a existing program can then also be analysed using that new framework. Might invite one last question, or we've got two. Three. Okay. We do have also just after 2 p.m. we'll be having some time for mingling, so there might be a chance to follow up then. But perhaps I'll go to this side of the room. Did you? Yes. Sorry. Okay.
Thank you very much for the presentation. I'm curious about the evaluation and what you're intending to look for in the evaluation. And the reason I raise that my interest is I live in a very large rural shire. Climate change does not feature at all in the budget, on the website, in any documentation in the Public Health and Wellbeing Fund. It's as if it, doesn't exist. So I'm going to be really curious to see, following this, whether we might be seeing some change at local government level. So yes, I'm just curious about your evaluation and what you're hoping to explore in that process.
Yeah, thank you. It's an excellent question, and I probably didn't spend enough time on it in the next steps, but certainly critical for, I suppose, understanding the potential impact of this project is to evaluate the tools, to have them piloted and assess how they could potentially be effective. So a big step for us next is to ensure that we disseminate widely and in first instance make sure that they are accessible to all local governments and through Venora and colleagues at the state government level. And then we will be seeking specific funding dedicated to an evaluation project that really tries to understand, similarly to what we did in the first instance, understand the practices that are being used to support decision and policy making, and where there are opportunities and entry points for us to better support either through the existing tools, but also to inform the development of additional tools. We recognise that it's very context dependent across local councils, and that was certainly representative in the diverse responses we got. That there are some councils where senior decision makers understand it and are champions and it's there, and others where we have to do a bit more work to explain why it's important and make sure it resonates and feeds into processes accordingly.
Thank you.
Thanks, Belle. We've just hit 2, so I'll hand back to you to close off. But if you're able to stick around, in those who are here in person, we will have time to have a more informal chat. And for any online, please feel free to post your questions in the chat and we'll take them on notice for the research team.
Thanks, Belle. Thanks so much, Elise. This concludes today's event. We're incredibly grateful to you all for joining us as we launch this toolkit today. As I said, it is really the first of what we hope will be a more extended and expanded toolkit. Again, I just want to reiterate my sincere thanks for the incredible cohort of policymakers who were so generous in their involvement during the project. And also to our research team members, both within and beyond the university. So Venora, Ro, Hassini, Elise and Fran online for your commitment and dedication to the project's successful delivery. We are very interested in taking feedback on the resources developed to date and would be interested to learn more from you about what your needs are, if this is an area you're working in, but also invite you to give us your thoughts in terms of how we can go forward. Finally, I'd like to take the opportunity to thank Maddie for calling in online today. It's so great to have your fantastic presence here, and congratulations again on the incredible work that you're doing at the national level and your national leadership in this space. That concludes the event today. So please, for those in person, join us for some light refreshments. And to those online, thank you very much again for joining us.